Hi, I'm Dr. Regina Fermonti, and in case you haven't heard, we are at the forefront of an adipose revolution. Now, what I mean by that is, as a board-certified plastic surgeon, I have spent over 2 decades honing my liposuction skills, only now met with patients that have lost massive amounts of weight. And what they're seeking is selective volume restoration, notably in the midface, temples, and hands, and a bunch of other areas too, which we'll talk about later. We now have two exciting products on the market, one with 7 years data, the other with about 6 months data in our practice, that boost fat production. It's not just about collagen production anymore. We are starting to replace like with like. That is, replace fat loss with a product that boosts your own fat. Let's take a look. So you can't cruise the internet without hearing words like injectable fat or off-the-shelf fat products. And it really all started with Renuva, which is an allograft adipose matrix. It's extracellular matrix, which is the growth factors of fat, harvested from a donor and applied in a syringe. We have a new kit on the market, and that's Lipoderma, which is actually a cryopreserved structural fat product. They have about 1.5 years of data in the wound care industry. The two of them together is pure synergy. You're getting structural fat with an extracellular matrix boost. They're injected in clinic, much like Sculptra and Radius. We use a cannula, lidocaine with epinephrine, and there's really no downtime. Here is our beautiful PA Lauren, who's lost about 30 pounds with diet and exercise, missing fat in her temples and midface. We performed an injection of Lipoderma in the midface and temples, and here she is before and immediately after. Again, restoring some of that youthful volume. And here she is right after, no downtime. And I love the morning after mirror pictures. You can see a little bit of bruising with the cannula site injection, but nothing more than you would see with a hyaluronic acid or a bioregenerative filler. The two of them together are pure synergy. Now here's a few of my lipoderma patients. This is a 6-week follow-up on all of them, midface and temples. And as you can see, you really are replacing like with like. You're replacing fat pad and temporal fat pad atrophy with just volume that just gets better with time. And again, we're coming up on 6-month data with this product and about 7-month data with Renuva. Now, imagine combining Renuva with Lipoderma, plus some of our energy-based devices that help tighten the skin pocket. They really are unprecedented non-surgical results in a procedure that used to require fat grafting via liposuction.